Hi, today I'm doing a physical respiratory assessment for my patient. So first washing my hands. Hi, my name is Mohammed Adnan. I'm the pharmacist. Can I take your name and date of birth, please? Thank you. Is it okay to call you Andy? That's perfect. So Andy, do you know why you're here today? That's right. So basically today we are here to do a physical assessment of your respiratory. We will be looking at your chest area, we'll be looking at your neck area, we'll be looking on your hands and your eyes. So overall, that's going to be our plan. Is that okay for you? Thank you. Are you comfortable here? Do you have any pain, any issues in getting up? No. Perfect. So let's prepare you for the respiratory assessment. So if you can sit at the angle of 45, please. Yeah, like that. And if you can expose your chest for me. Thank you. So basically, I have got your observations, your temperature, blood pressure, respiratory rate, and your oxygen saturation. This seems fine. So the first of all, I'm going to do end of bed observation. So I will be looking at the adjunct treatment along the backsides, any inhalers, any drips, to see what sort of treatment going on. Then I will be looking at your then I'm going to check any shortness of breath, any wheezing, any central or peripheral cyanosis, and looking for chest trauma, any chest drainage. I will be looking at your hands, see, and I'm doing the capillary refill, pressing it for 5 seconds, and it should refill in 2 seconds. That's fine. So if you can do like this, so that's I'm checking the clubbing of the fingers, which is not there, so perfectly fine. So if you can do like this, please. So that's fine. Tremors, I'm looking, there's nothing there. And now if you can do like that, the flapping tremors, that's perfect. I'm just checking the temperature of your arms. Yeah, that seems to be fine, no problem. Now, looking at your eyes, checking your conjunctival pallor, which seems to be fine. It's nice and pink color, no sign of anemia. And now, if you can look at the left side, turn your neck. Yeah. So, looking at the jugular venous pressure, it seems to be normal. There isn't any fluid overload issue I can see. Now looking at your checking supraclavicular lymph nodes, so standing at the back and just going through, checking if there's any swelling, any issues. There's no swelling. Now looking at the chest, thorax observation, any signs of muscle wasting, any signs of any changes in the color, any chest deformities, any spinal cord deformities, or respiratory pattern. That seems to be okay. The next step is palpation. So I will be checking the chest expansion. So first I'm looking at the trachea with 3 fingers, just checking if the trachea is central. Sternal notch, checking if it. That's central, that's perfect. Now if you can take deep breaths, please. So checking your chest expansion. Okay, that's fine. So I'm checking at the front as well as the back. Now looking at the after chest expansion, I'm doing tactile vocal firmities. So if you can say 99, 99, 99, 99. Thank you very much. Now I'm going to be tapping my finger against your chest, starting from clavicular area, and it's going to be ladder pattern, 6 anterior and 7 posterior. Thank you. Now I'm going to be listening to your chest sounds. If you can take deep breaths, again starting from clavicular area, it will be 6 anterior, 7 posterior, and it's going to be ladder shape, ladder pattern. Thank you very much. That's the end of my observation. Thank you.